One is the pseudophyllidian cestodes. Only remember the example of that. The example is Diphyllobothrium latum, the fish tapeworm. The fish tapeworm, Diphyllobothrium latum. The second one, that is the cyclophyllidian cestode. The cyclophyllidian cestode includes Taenia saginata, Taenia solium, H. nana, H. diminuta, and D. canium. Important: Taenia saginata, Taenia solium, and H. nana. And for you people now, Taenia saginata and Taenia solium are important. The pseudophyllidian cestode, the example is fish tapeworm. You have already know that this is the, in this group, pseudophyllidian cestode. So attachment molecule is known as bothria. The attachment is different. The attachment molecule, attachment head, this head portion is slit and it is called bothria. And there is no rostellum. No rostellum. Cyclophyllidian cestode possesses cup-like and round suckers called acetabula. Round suckers and rostellum as such called acetabulum. And larval stages in man, in hydatid cyst, we will discuss this later. Now the difference between pseudophyllidian and cyclophyllidian. Head or scolex, pseudophyllidian bears two slit-like groups, bothria, and here cyclophyllidian bears four cup-like suckers. Uterus, no branching, and here branching is present. Uterine pore present, absent. Common genital pore is ventral, in the midline is lateral. And eggs, operculated eggs. Operculated means with a cover. This is known as operculum. A cover is there. So operculated eggs. This is classical of pseudophyllidian. And here, in case of cyclophyllidian, that is in case of Taenia solium and saginata, there is no operculum or operculated body is absent. The pseudophyllidian D. latum, although it is not important for you, but it is fish tapeworm. The life cycle is a bit different. The first, I will show you the picture first. This is the Diphyllobothrium latum. See the head, think about the length of that, almost about 10 meters in length. The adult worm, the fish tapeworm, it is known as fish tapeworm, and morphology, adult worm is yellowish grey in color. The dark central markings are there in the strobila are due to the egg-filled uterus and measures about 2 to 10 meters in length. The lifespan is for a period of 5 to 15 years. And scolex bear two slit-like groups called bothria. Scolex has no rostellum, no hooklets. Neck is thin and unsegmented and is much longer than the head. This is the gravid proglotid. 3,000 to 4,000 proglotids are there. 1, 2, 3, like 3,000 to 4,000. A mature segment is filled with male and female reproductive organs. The terminal segments shrink and becomes empty as eggs are constantly discharged. Uterus at the center of the segment appears in the form of a rosette. At one end and a small knob at the other. This is the small knob and this operculated egg. It is not clear from this picture, but there is an operculum, a cover. Does not float in the saturated solution of common salt. egg passed in feces. This is Coracidium, ciliated, and then the Coracidium eaten by the copepod or cyclops, the cyclops, and from the cyclops, prosarcoid form is formed, and fish eat copepod, and then it is called pleosarcoid develops in the fish muscles, this pleosarcoid form, taken by the human being, and then ultimately the adult tapeworm in the small intestine is formed. So this is the cycle. Just to know that the two intermediate hosts are there. One is this copepod and other one is fish. Here is the picture from CDC. This is the Scolex bothria, the entire adult worm, adult small intestine. The proglottids release immature eggs, and unembryonated eggs are passed in feces, and eggs embryonated in water, then Coracidium to prosarcoid larva. From the fish, human ingest raw or undercooked infected fish, and then the cycle is repeated. Now the most important chapter, D latum is not important for you, but however, this is Taenia saginata, and this is very important for you. You can see that it is known as beef tapeworm, unarmed tapeworm of man, where this rostellum is absent. That's why it is called unarmed tapeworm of man. You can see here no rostellum, only 4 saccades are there. The measures about 5 to 10 meters or sometimes up to 24 meters. Survival time up to 10 years. The Taenia saginata, 1000 to 2000 proglottids. Common genital pore is marginally situated. Vagina is provided with the sphincter muscles. The gravate proglottid, this is important, the gravate proglottid consists of uterus and the central longitudinal stem. This is the central longitudinal stem with 50 to 30 branches on each side. 50 to 30 branches on each side. That is the sphincter of the vagina. The highly branched proglottids. The gravate proglottid contains 97,000 to 1,24,000 ova. And gravate segments are expelled singly and force their way through the anal sphincter of the human being, and free gravate proglottid crawls out of the anal orifice and oviposites on the perianal skin. This is the adult one. The ova, liberated by rupture of the proglottids, no uterine opening, spherical, thin and outer transparent shell. The inner embryophore is important. This is the inner embryophore. Is brown, thick-walled and radially striated. This is radial striation, radial striations. Radially striated, the outer wall. Has an oncosphere with 3 pairs of hooklets. 3 pairs of hooklet, this is classical of this Taenia species. Three pairs of with 3 pairs of hooklets. Does not float in saturated salt solution, and eggs are resistant and remain viable for 8 weeks, infective only to cattle. So this one is only infective to cattle. We'll compare it with Taenia solium later. The final host is man, intermediate host is cattle, cow, buffalo, mode of infection eating beef containing Cystis sarcas bovis, pathogenesis geniasis, the infection, the passage of proglottid in stool, mild irritation at the site of attachment, epigastric pain, weakness, all vague symptoms, an obstruction in intestine but also in bile and pancreatic ducts may rarely occur. Appendix because proglottids are actively motile. Appendicitis is a possibility because these proglottids are actively motile. Diagnosis: identifying characteristics of eggs, proglottid and scolex. and usual specimen is gravid proglottids, that is visually observable in a stool specimen, and treatment by praziquintal is the drug of choice, 5 to 10 milligram per kg of body weight, a single dose. And the criteria of cure, this is very important. What is the criteria of cure? Recovery of the scolex. You have to collect the entire stool material, and by a filter paper you have to filter it out. The scolex is visible. Until and unless the scolex is expelled, the infection persists. So, finding of scolex in the stool material is the sign of the therapy, proper therapy. The negative stool examination 3 months after treatment is also required. The Taenia solium is the pork tapeworm and the arm tapeworm of man because of this thing, rostellum. The teniasis is common among those eating raw and insufficiently cooked measly pork, uncommon among non-pork eaters. Scolex is globular. Here you can see the scolex is globular, and here is the rostellum. The scolex has a rostellum armed with a double row of alternating large and small hooklets. The rostellar hooklets are shaped like daggers. This is the picture of rostellum. And 4 suckers. The rostellum, the suckers, entire thing is the scolex, globular in nature, short neck, immature proglottids and mature proglottids, and then this is the gravid one. The gravid one is like that. Survival time is 25 long years. Here 800 to 900 proglottids are there. Common genital pore is marginal and thick-lipped. Vaginal opening is not guarded by a muscular sphincter, and gravid segments are expelled passively in chains. In Taenia saginata, it is expelled actively. And gravid proglottids contain approximately about 30,000 to 50,000 eggs. Ova cannot be differentiated. Taenia solium, Taenia saginata, it is impossible to differentiate it by the egg. Final host is man, intermediate host pig. Mode of infection eating measly pork containing Cystosarcus cellulose. Cystosarcus cellulose is seen not only in pig but also in human being. So that's why Cystosarcus cellulose or pork tapeworm is important. The diagnosis, stool examination for proglottids and egg. Taenia solium pathogenesis is mild non-specific abdominal complaint. Proglottids are not as motile as Taenia saginata, so appendicitis is less common. And cystosarcosis is a short note, multiple, develop in any organ or tissue. Neurocystosarcosis, most serious zoonotic disease, involvement of brain, chorioretinitis and vasculitis are the possibilities. Diagnosis, intestinal, identifying the characteristic proglottid eggs and scolex. Cystosarcosis, computed axial tomography or magnetic resonance imaging, where the calcified lesions are seen in brain. Treatment by praziquintal, and criteria for cure is recovery of scolex and negative stool examination 3 months after treatment. Remember, this particular thing is the criteria of cure. Recovery of scolex is important. This is the life cycle as per CDC. And the difference between Taenia saginata and solium, the length, the head and scolex, the difference you know, the number of proglottids, expulsion, uterus and testes, the number of testes. Now you have done few important points. Please write the clinical features of Taenia species. Long question as well as short note. One side write Taenia saginata, other side Taenia solium. At the left side write the common name. On the left side the common name, then Taenia saginata, Taenia solium. The common name of Taenia saginata is beef tapeworm. Taenia solium, pork tapeworm. Habitat, jejunum, jejunum. Morphology, adult worm, tape-like in case of Taenia saginata, 5 to 10 meters in length, white in color. I repeat, the left side, write morphology, adult worm first, underline it. Taenia saginata, under Taenia saginata, it is tape-like, 5 to 10 meters in length and white in color. Taenia solium, same tape-like, but 2 to 3 meter in length. 2 to 3 meter in length, Taenia solium. Same white color, adult worm. Then the most important point of Scolex, S-C-O-A-D-X, Scolex, underline it. Taenia saginata, large, comma, quadrate, Q-U-A-D-R-A-T-E, quadrate, with 4 suckers, quadrate, with 4 suckers. This one is globular, Taenia solium. Taenia saginata, large, quadrate, with 4 suckers. May be pigmented. Taenia solium, small, globular, with 4 suckers. Taenia saginata, head without rostellum and hooklets. Head without rostellum and hooklets. T saginata, no hooklets, no rostellum. But in Taenia solium, there is hooklets and rostellum. The head provided for Taenia solium, the head provided with rostellum armed with double row of alternating large and small hooklets. Taenia solium, head provided with rostellum armed with double row of alternating large and small hooklets. Next point, neck. Taenia saginata, long neck. Taenia solium, short neck. Next point, segments on the left side. Underline it, segments. Bracket, proglottids. The segments are called proglottids. Number of proglottids, 1000 to 2000 in case of Taenia saginata, 1000 to 2000. Solium, 800 to 900. Gravid segment. Next point, left side, gravid segment. 20 into 6 millimeter. Saginata. Solium 12 into 6 millimeter. Expelled. Next point, expelled. E-X-P-E-L-L-E-D. Expelled. Taenia saginata, singly. Segment singly expelled. One segment at a time. In case of solium, in chain of 5 or 6. Uterus. Next point. Central longitudinal stem with 15 to 30 lateral branches. These are called lateral branches, and this is the central line. So each segment, there is a central longitudinal stem or line with 15 to 30 lateral branches in each side. In case of saginata, 5 to 10 lateral branches for Taenia solium. Only 5 to 10 lateral branches from Taenia solium. Common genital opening. In the posterior or lateral margin of each segment. The posterior or lateral margin of each segment in saginata. And in case of solium, mid-lateral. Vaginal sphincter present in case of saginata. Solium is absent. Testis. It is a hermaphrodite, monoecious. Testis 200 to 400 in number in saginata and 150 to 200 solium. Lifespan. Saginata 10 years. Solium 25 years. The period of survival is 25 years. It is getting long time to invade the tissue. So tissue invasion is there in case of solium. The lifespan is short in case of saginata. Tissue invasion, the possibility of invasion is rare. That's why cystic cellulose is seen in human being because of this long survival period of 25 years. Eggs. In saginata, it is acid fast. Taenia saginata, eggs, these are acid fast. Taenia solium, non-acid fast. Color. These are not separable. Same in case of saginata and solium. Brown in color, that is bile stained. So example of bile stained ova, Taenia solium and Taenia saginata. Two membranes are there, two outer membranes are there, one outer and one inner. Two membranes are there. The outer is thin. Two membranes are there. In case of egg, the outer is thin. The inner membrane is embryophore. Embryophore. It is thick, brown, radially striated. It is thick, brown, and radially striated. Radially striated. and enclosed the embryo, the oncosphere. Embryo that contains 6 hooklets. 6 hooklets. Hence it is called hexacanth embryo. Short note is hexacanth embryo. Infective to Taenia saginata is infective to cattle only, but solium is infective to pigs and as well as human being. The larva in saginata is called Cestodes bovis, and Taenia solium, it is Cestodes cellulose. Cestodes cellulose is a short note for you. The site it is of larva. So larva, name of Cestodes bovis in case of saginata, and larva Cestodes cellulose for Taenia solium. Site in case of saginata is 5 to 10 millimeter, and Cestodes cellulose is 8 to 10 millimeter. 8 to 10 millimeter. In case of saginata, it is present in the muscle of cow and buffalo. Saginata, Cestodes bovis present in the muscle of cow, and Cestodes cellulose found in muscle of pig as well as in human. So muscle involvement is there, is a possibility in case of human being. Cysticercosis in human, in case of saginata, does not occur. Cysticercosis in case of human, in case of Taenia saginata, it does not occur. And cysticercosis in case of Taenia solium is a possibility and a fatal systemic condition. It is a fatal systemic condition in case of Taenia solium. Cysticercosis cellulose is a fatal condition found in muscles, in subcutaneous tissue, in brain, eyes. In brain, it is called neurocysticercosis. If the lesion is in brain, it is called neurocysticercosis. Clinical feature is almost epileptic seizures, fainting, sudden fainting, blurring of vision, severe headache, intense headache. Diagnosis: antibodies detected cysticercosis, neurocysticercosis, diagnosis of neurocysticercosis. Antibodies detected by ELISA test. Number 2, immunoblot test from CSF. Immunoblot test from CSF. Immunoblot from CSF. Number 3, antigen detection from CSF by ELISA. Number 4, CT scan and MRI to demonstrate calcified space occupying lesion in brain. CT scan and MRI to demonstrate calcified space occupying lesion in brain. And finally, tissue biopsy. This is a very important question. Every time, almost, it is a catch question, a theory paper, as well as in the oral table. Taenia solium and Taenia saginata. I have prepared this chart for you because reading all those things is very difficult from textbook. Only read this chart and this is enough for you. Thank you.